So today is about celebration. It's about taking this opportunity to lift our spirits and remember what we do. We frequently are busy climbing that hill, thinking about what we haven't done, what we've got to achieve, the time and the challenges that we face. We rarely stop and think about what we've achieved, and we've achieved a lot. So today is a time to congratulate ourselves about those achievements. Stop and reflect. And by the way, it would be really good if we had a bit of fun on our journey, wouldn't it? And today we are going to have some fun. Don't panic. Nobody will be role modelling or doing anything that they don't feel comfortable to do. But we will be having opportunities to laugh and smile as we as nurses so frequently do. As a nurse, I know the great challenges that you all face every day with your patients. And only this week alone, we've really had to think about some of the challenges that nurses have done. You know, if you think about Edith Cavell, 100 years ago, when she ended up being shot for the fantastic work that she did, going the extra mile. If you think about our colleague, Pauline Cafferty, who's currently in hospital in London, having gone the extra mile to care for patients with Ebola. And I can think of many, many nurses and midwives in this health board, the day in and day out, go the extra mile for their patients. And I thank you for doing that. So today, let's have a little look at where we are and what we've achieved. So this is our health board strategy on a page. So caring for people, keeping people well, which is pinned to those lovely nurses in your bags, whether they're male or female, but squishy to manage stress, is our strategy for the health board. And many of you will remember when we last came together 2 years ago, we launched our nursing and midwifery framework that will sit underneath this strategy. That framework set out our mission and our vision as nurses and midwives within this health board. Most importantly, to deliver outcomes that matter for people. And without question, we are doing that day in and day out. But we set ourselves some goals within that framework. So let's have a little look at how we're doing at achieving those goals, shall we? Our first goal was to be professional. Professionalism, old-fashioned word, but something that's very dear to most of our hearts and something we try to do every day. But we need to be sure that as professionals who are accountable for practice, we have frameworks in place to demonstrate that. And I'm delighted to say that every 6 weeks, I meet with some of the most senior nurses in the organisation to ensure that all our nurses are registered, that we are protecting those who are most vulnerable within our care, within line with our code of conduct, that we are concentrating on the fundamentals of care whilst we push the boundaries of improvement and advanced practice, that we are meeting the nursing and midwifery indicators, which I'm sure the CNO will speak a little more about this afternoon, and that we are safe, that we have enough nurses to be able to provide care to our patients on a day in and day out basis, a challenge that we all know is a national challenge, not something that we're just facing here. It's really important, isn't it, to find out whether our patients think we are professional or not. And this is what they're telling us. They do believe we treat them with dignity and respect. They do feel that their stay in hospital in this case was they were treated respectfully at all times. Really important for us as professionals and difficult and challenging at times to deliver. They also tell us that sometimes we don't quite get it right. But I've never known a curtain be anything other than a challenging barrier that we all have to face. Now, they're hospital-based examples, but you will see in the posters downstairs some fantastic examples of what our patients are also saying in community settings. Since we last met, we've had a new code of conduct, a really important document that underpins what we are expected to provide and how we're supposed to behave. I'm delighted to say that that fits with the behaviours and values of the organisation. So they are aligned, they are not different. I'm delighted to say that I'm seeing a few less people to talk about Facebook these days. Maybe we're making progress there. But we do still have people who don't behave professionally within the organisation, but they're few and far between when you consider how many of us are employed within the health board and how frequently we are in contact with patients who sometimes don't want to hear what we've got to say. That's a real challenge, but we do continue to meet our code of conduct. And of course, the code of conduct is now becoming extremely relevant in line with revalidation. And I am delighted to tell you that on the 8th of October, that's last week, the Nursing and Midwifery Council agreed that revalidation would be introduced across the UK into Europe and for any registered nurse that wished to work in this country. There are some changes to the model, but they're minor. And Aaron is going to put a session on for us this afternoon where people will have the opportunity to really understand revalidation. But just so you understand the size of this for our health board, there are, in 2016, 1,153 of our nurses and midwives will undergo revalidation. So we need to be ready. By March 2019, 4,600 of us will go through revalidation. And Judith, as my deputy, will be one of those first individuals to go through. So make sure that we've got our act together, because we need to be leading you and demonstrating to you how you do this. But it's not just our responsibility as an organisation. It is also your responsibility as individuals who have to get a licence to practice. And I really, really don't want to be having to have conversations with you because you don't have a licence to practice. So take your opportunity. Aaron is probably the most popular person in the organisation at the moment as the man who has all the knowledge. Aaron, where are you? Do you want to stand up? Just in case anybody didn't know, he's over there. And he will be circulating as the day progresses. And I'm delighted to say that today will count to allow you to revalidate. These are the key areas that we need to revalidate on. So you will be able to add some of this to your hours of reflection, opportunity to discuss with colleagues. But please don't forget that your PADR and the use of your code of conduct are going to be fundamental to this. So you will hear our colleagues in HR frequently reminding us that we need to do PADRs. Yes, we do. We need to give you the opportunity to develop and grow, but you need it to get your licence to practice. So don't underestimate how important this agenda is going to be for us, but also how ready we are to take that agenda on. Okay, so our second goal was about compassion and caring. We've undertaken 7,000 real-time surveys within this health board since we last came together, and that doesn't include all of those surveys that are being done by individual clinical teams across the board in community, outpatients, and paediatric settings. And you'll notice there's some smiley faces on here. The way in which we present this data is a way that the public can understand. But this is what our patients are saying about us. This is what concerns them. So when we talk about what's important to our patients, these are the things that are important to our patients. And with social media, they frequently tell us what they think. So this is what our patients said, and this is what we did. But of course, if you come back to the strategy, it's not just about what our patients are saying about being in the organisation and using our services. It's also about what we as staff think. And it is good to note that a number of staff are saying that they are much more satisfied with the care that they are providing for their patients and their family. And that number is increasing. We've still got work to do here so that we feel confident that the quality of care that we give to our patients is of the standard that we would expect. As I said, social media is something common. It's not unusual at all for patients to be sitting in our beds or using our community services and tweeting us and telling us what they're like. Sometimes they're saying, why am I waiting for all this time to see somebody? Those of you who work in A&E will know. Sometimes we're answering those directly from our communications team into the senior nurse, so the senior nurses can have those conversations with patients. But they also say an awful lot of wonderful things about us as nurses in this health board. And that's what's important, the quality of care that we give to our patients. Goal number 3. Goal number 3 was making every contact count. If we don't take opportunities to make sure that we're educating our patients so that they consider their own personal health, but also making sure that we have services that are sustainable, remember, we're an expensive workforce. I know it doesn't feel like that when you're paying the bills at the end of the month, but actually we are quite expensive. So we need to be able to demonstrate that we are making a difference for our patients. So making sure that every contact count is absolutely key with that. And these are just some of the examples. And you will find, as you look at the posters today and you listen to our speakers, that we are doing a considerable amount to educate our patients and make them and help them make the right choices about their care now and in the future. So, leadership, frequently used word, really important word. We have had 504 nurses attend leadership programs this year and demonstrate how they're taking things forward within their clinical areas. 150 newly qualified nurses have attended the Nurse Foundation Preceptorship Programme to set them on the right direction to be the nurses that they want to be and we need them to be. Because remember, they're the ones that will be caring for us when we get old. So we need to get it right now. So ensuring that we put them on the right path with preceptorship is absolutely key. So for the students in the room, please note we do have a preceptorship programme and we value that dearly. We also know that we have 1,265 registered nurses trained to be mentors in this organisation to support those students as they go through their training. We have 28 nurses who are studying currently at advanced practice level. Really important as we look at the models that we are providing and the way in which we're delivering services. Who'd have thought just 15 years ago that nurses would be triaging, assessing, diagnosing, treating and prescribing for our patients? But they are, and they're very capable, and the audit tells us that actually they do an extremely good job. 200 nurses and midwives have enrolled on BSc and MSc this year alone in order to advance their skills and develop themselves as individuals. These are the leaders, these are the individuals that will help us take this agenda and our strategy forward, both for nursing and midwifery on the health board. So how do we ensure that the leadership gives the right clinical care to our patients? So it's fine having leaders. Leaders can just go lead everybody everywhere. But if we lead them in a chaotic manner and don't actually focus on what is important to us, then actually we aren't going to progress these agendas a great deal. Since we last met, we've had 24 external reviews. Those reviews are public and they demonstrate whether or not we are providing the fundamentals of care to our patients. Yes, there's some things we need to improve on, medicines management being a key to that. But in general, those reviews have been absolutely extraordinary in the fact that they believe our staff are wonderful in giving high quality care to our patients. And we know, if you just read some of the issues that are coming out of Betsy Cadwallader, we need to be alert and constantly checking. And that's why we have an internal inspection team that turn up in clinical areas across the health board before the inspectors call to check that we're doing the right thing. And they tell us the same. They tell us we're getting it right most of the time for our patients. And that's fantastic. So be very proud of what you're doing. But of course, we need to have the right workforce. So how do we value and develop our workforce? Well, I'm pleased to say that we have 3,707.20 full-time equivalent registered nurses in this organisation, and unregistered nurses, 1,539.7. That's a lot of nurses, isn't it? You know, we're a big, big workforce. We are one of the biggest organisations that provide healthcare in the UK. So what we do and how we lead and how we behave will influence the profession of nursing and midwifery across the UK and across the world. And many of you have published in the last few years, and you will know the impact that has when you share your excellent practice with others. We do know that we don't have enough nurses. I met with Raj, our current Interim Director of Workforce, and we are 161 nurses short at the moment. So, what are we doing? Well, we have recruitment campaigns, and we are about to go abroad internationally and into Europe to recruit colleagues. We've increased the numbers of students that are going through training, and we are looking at how we're using our bank. And in order that we can grow the workforce that we need, but we're also looking at the way in which we deliver services. Do the jobs that nurses need to do, are they always nursing jobs? Could there be jobs undertaken by others? I've never always understood why we need a healthcare support worker that works with nurses who's different from a healthcare support worker that works with physios or OTs. If you work in a rehabilitation setting, wouldn't it be good to have a healthcare support worker that knew what the OT did, knew what the physio did, and knew what we did in nursing? And we developed those individuals to actually give us the bespoke support worker that we require. And some of you, your colleagues in mental health, have been working across the boundaries for many, many years now in ensuring that we are working in an integrated way with our social care colleagues. So I think we will see this agenda develop and grow as we start to get the right workforce for the patients that we're caring for. Now, service improvement. Well, many of you have been on the LIPS programme, and only yesterday I was hearing about things that people were doing with Mr. Potato Head in relation to PDSA cycles. What that has done for us is allowed us an opportunity to start to understand how improvement can make a difference. And we've got lots and lots of examples of those today. But also you will see that nurses are very much involved now in some of our big key pieces of work. So Havany Coid, the mental health unit at Landock Hospital, will be opening shortly. And I can't wait because I'm getting the opportunity to have a little look at that on Friday. And of course the new Children's Hospital for Wales. For those of you who haven't had the opportunity to go there, please do go and have a look. It's such a wonderful environment. In fact, some of us had a chance to see it on the TV last night. So it's not always bad news that the media give us. It's frequently quite good. So, these are just some examples of the fantastic improvement and innovation that is going on in our health board currently, being led or involving nurses and midwives and healthcare support workers. And as I said, 81 posters and 24 concurrent sessions today are all about innovation and improvement. So we're not innovating and improving and just giving the quality of care to our patients that we should, but actually people are beginning to recognise that we're not bad at this. Since we last met, Ruth Owens became RCN Nurse of the Year. You will know that Ruth followed Louise Poley, who'd been RCN Nurse of the year before. We've had a few more winners and runners-up during 2013. And what about 2014? Didn't do too bad then either, did we? And next month, it'll be 2015 RCN Nurse of the Year Awards. I wonder how well we'll do next time. Now, some of our neighbouring health boards are getting a bit miffed with us that we keep winning these awards. Can't understand why, personally. I think we deserve them. So they're upping the game a little bit. So we need to make sure that we continue to do that. But I am delighted that we are winning these awards, and I'm very, very proud of those individuals who are being recognised for the fantastic work that they do. That ends my presentation today, but I want us to remember a few things. I want us to stop today and remember what we are achieving. Take that opportunity to be proud of being a nurse and a midwife, but particularly be proud of being a nurse and a midwife in Cardiff and the Vale Health Board. to look at the achievements that colleagues are going to share with you today. But remember, there are nearly 400 of us in this room. If we share, that's with one person, we share 800 achievements and knowledge. So if I ask you nothing else, I ask you to take away one thing today. So stop and reflect, celebrate your achievements, share with colleagues. Oh, and by the way, we're going to have a bit of fun. So enjoy your day. Really, really enjoy your day. Take this opportunity. Thank you to those who attended today, but also to those who supported individuals to attend. And as is always the way with conference, we are going to begin with a patient story. Thank you very much.